We look at another different type of shunt today, and this is known as a mesocaval shunt. All right, so mesocaval for me, if I look at the word mesocaval, I can actually derive two words from it. Okay, I can see meso, that's kind of like mesenteric. Then I can see what cava, that's kind of like what inferior vena cava. Okay, so me, that's just how I do, and I actually what get to cram these things. Okay, so you can see the mesocaval anastomosis. These are the different types of anastomosis. You just leave them. We are focusing on this one, which is mesocaval anastomosis. You could see that there is a shunt, there's a connection between the inferior vena cava and the mesenteric um superior mesenteric vein. Sorry. Okay. So we'll talk about this mesocaval shunt under indications, contraindications, surgical technique, types, advantages and disadvantages. Okay, so this mesocaval shunt is actually a surgical procedure which is what done to create a connection between the superior mesenteric vein and the inferior vena cava, and you are doing this because there is what portal hypertension. All right, portal hypertension, that's when there is increased blood flow to the liver. All right, so you want to reduce the portal hypertension. It's one of the surgical treatments for portal hypertension. Okay, so indications when you should do this: if the patient is having variceal bleeding, if they're having refractory ascites, that means the ascites is coming, treating is going, is coming back, right? If they're having hepatic what hydrothorax, if there's portal hypertensive gastropathy, if there's a Budd-Chiari syndrome, okay, you might actually what opt in for this surgery. The contraindications: if they're having severe dysfunction, that means like when you shouldn't do the surgery, but probably you should give it some time first, right? If they're having severe liver dysfunction, they're having portal vein thrombosis, if they're having hepatic vein thrombosis, the inferior vena thrombosis, okay, inferior vena cava thrombosis. Then if they have previous abdominal surgery, you just kind of like chill a little bit first, okay? Now, moving here to the surgical technique. For the open one, you just do an abdominal incision. You mobilize the superior mesenteric vein. That means you try to like locate the superior mesenteric vein. You also try to locate the inferior vena cava. Okay, then you now anastomose the two of them. Okay, types. Okay, looking at this now. Okay, types of the surgery. Yeah, we have the real mesocaval shunt, and we also have the H-graft mesocaval shunt. Okay, advantages. This will help you reduce portal hypertension. All right, it will decrease variceal bleeding. So it will improve ascites management. It will reduce liver function. Okay, to preserve liver function. Sorry. Okay, to preserve liver function. Instead of portal hypertension, I want to remove the liver or remove some part of the liver, you are not doing an alternative. So this will help you preserve the liver function. Then there's also low risk of what hepatic encephalopathy. That's a problem from the liver affecting your brain. Okay. Disadvantages: it requires specialized surgical expertise. There's risk of shunt thrombosis. There's a potential for what renal dysfunction. It may require what anticoagulation therapy. Complications: this will lead to what shunt thrombosis, renal dysfunction, hepatic dysfunction, infections, and hemorrhage. Okay, so that's it for this mesocaval shunt.